Welcome to the Everything Cancer podcast, where guests offer insight into the honest survivor experience, how challenges are met head-on, where blessings are discovered, and helpful information is shared. We are so glad to have you here, and we hope you enjoy today's episode. As you know, the information shared on the Everything Cancer podcast is not intended as medical advice. Always consult with your healthcare team. We would love to hear from you, your suggestions for topics or guests, and your comments about the show at everythingcancerpodcast@gmail.com. Remember to rate us on your favorite podcast platform and tell others about our show. Now on to the episode. Hello, everybody, and welcome to the Everything Cancer podcast. We have a very interesting guest with us today, Jason King. And he is the assistant manager of the Prisma Health Cancer Institute Center for Integrative Oncology, Survivorship, and Center for Cancer Prevention and Wellness. And that was a mouthful, Jason. And I hope I didn't trip over anything too much.
No, you did great. Thank you.
Thank you. But all of those are really important and very key. And I love everything that you have included in that title. So can you tell us about your center and how you got there and how your center got there?
Sure. So Jason King, like you said, I'm a nurse manager here. I've been a nurse for about 27 years, and the past 20 years of that have been in the oncology space. 10 of those, about 9 or 10 of those, I was actually a chemotherapy infusion nurse. And then came here as first our coordinator of our oncology rehab program, and then supervisor of our oncology rehab program, and went to assistant nurse manager.
That's a long and storied history. And how did your center develop? I mean, it sounds like it has really pulled several disciplines together.
Yeah, so our administrator actually sought out my director back in 2012. We started off really with just 3 individuals. You know, we had a dietitian, we had my director who was a nurse practitioner herself. We had a social worker. We, at the time, enveloped our oncology rehab program that was already been in existence since 1991. And so really just started about 3 or 4 multidisciplinary individuals and started seeing patients. And it was some of the first visits that we did were the survivorship care plan visits. So, and then from there, we've morphed over the past, 11 years to 33, a team of 33, and offer services that range from, along the cancer continuum, from cancer diagnosis into cancer survivorship and cancer prevention.
Wow. So staff of 3 to 33 in that amount of time, that's a tremendous amount of growth. And it shows the amount of value that your system places on this. What do you see as the value? Why do you think it's grown that way?
I think, coming from being kind of on the front lines with the patients, at a chemotherapy infusion nurse, I see when I was a chemotherapy infusion nurse, we had just a few things to offer the patients. I knew about look good, feel better. I knew about the prostate, group, us too, that was for men. And that was about it. I had no other options really for patients. I don't even think at the time that our local cancer society was around. I didn't hear about it. And so for us to really come and develop this program and have all these offerings for patients now and see that grow over these 11 years is just almost unimaginable. And it's awesome that we have it. Nutrition therapy for free for patients, sexual health visits, cancer genetic visits, lifetime clinics for patients who have, are out, 3 to 5 years from treatment, oncology rehab, social work, all those things we can now offer. Those just didn't exist, even 10 or 11 years ago for our cancer institute.
And so how do patients benefit from all of these being in one place?
Well, we are a destination clinic. So So in some ways, I mean, it's great to have all those services here. We do serve a large population of people. So we are the largest employer in the state, largest healthcare organization in the area in South Carolina. So we do have offices that, even though we're in Greenville, we have people who come from an hour either way. But it's still great to have the services because patients do benefit, of having a multidisciplinary team, where they can come and not like almost like one-stop shopping in a way, but you're going through cancer treatment and it's like, you are suffering from fatigue. So, oh, we have an oncology rehab program that you can benefit from. Or, you're having trouble, with your diagnosis, or your children are having trouble coping with your diagnosis. We have child life specialist, or we have social worker who does one-on-one counseling. Are you having trouble with bills? We have social workers who can help with financial navigation. So there's just all these different things we've tried to build in the cancer support arena for our cancer survivors.
I mean, there's a lot of needs for cancer survivors. There's so many psychosocial needs and so many physical needs, and they're so interlaced. They all affect quality of life, how well you're able to interact with your family, how well you're able to return to work if you need to do that, which many people do because so many of our survivors are younger now. Or we have people that need to work when they're older. I know I'm preaching to the choir. There's so many needs that need to be met from so many sides, and you're able to do that. How do you think you are impacting quality of life for the people that come to see you?
I certainly think it's very beneficial to think about, and I've seen it as an infusion nurse many times, patients come in and sometimes it was just them. They had no family support. They might have a neighbor that would bring them and stuff, and so just knowing that we can help them if they're struggling financially, if they need that one-on-one, individual social work counseling, ride share, anything we can help them with. We now have those tools. We now have a toolkit and things we can offer. And even if, say, we can offer it here, because naturally we can't meet all their needs, but we work with our internal partners and our external partners. So we do work with the cancer societies in the local area, so what they can do for patients. So sometimes we can't do something, but we know how to get them to, who can help them, which I think is great.
And I'm sure your oncology rehabilitation specialists and your sexual health specialists really make a big difference for people that oftentimes I think are unmet in other areas that don't have a clinic such as yours.
Exactly, especially sexual health. We all know that providers don't want to talk about sex with their patients. They're most in all honesty, usually the providers are focused on the patient's treatment.
Right.
They have that 15 minutes appointment with you. How are you doing with your treatments? What are your side effects? How can we help you? But it's just a really short visit, and they do try. But, what we can do and how as we've built our program, to help the patients and the providers is like, just send them to us, send them to one of our visits. We have what's called the Integrative Oncology Survivorship visit, where we see patients typically like cycle 2 of treatment, but they can really come anytime. They're like, send them to us. We can see what their needs are. We can plug them into what they need. And so, educating our providers that we have that here, educating our patients too, putting that advertisement out into the offices. Have you been for an iOS visit? Have you talked to your provider about it? So, just trying to help both the patients and the providers and educate them that, we can take care of stuff. Just send them to us.
So what is an iOS visit?
So it's funny. It actually, I mentioned earlier, started just doing the survivorship care plan visits. So we would bring the patients in. They would meet in a 1-hour session with either a nurse practitioner or physician, a dietitian, a social worker, and nurse navigator. And so we would go over, we were seeing them at the end of treatment at the time. And we would give them that survivorship care plan visit because we were tasked with kind of doing that. But they also would get a really short visit with the dietitian. If we need to plug them into the onc rehab, we could do that then. But we learn from the patients through feedback, through doing our own surveys, oh, I wish I knew about your services when I was diagnosed, which makes total sense, right?
Mhm.
So,
Right.
so we actually changed that to the integrative oncology survivorship visit. We actually moved the survivorship care plans out back to the offices with the nurse practitioners. And then we worked with our electronic medical record to auto populate on some of the care plan or some of the, when a patient's put on a plan of care, to auto send that referral to us. And so we'll reach out to the patient, please come see us for your integrative oncology survivorship visit. Explain to them, what it's about. We're trying to treat the patient holistically, or like
Okay.
treat the whole patient is
Right.
what we're trying to do.
Right.
So, talk to them about what have been their concerns up to that point, wherever we see them in their treatment, whether it is that cycle 2 after treatment, or maybe they have finished treatment, they're just getting
Mhm.
to us. What are your concerns? What's been your concerns? How can we help you? And then plug them into our services, whether internally or externally. We plug them into we have what's called cancer support community. We were the first in-hospital partner with cancer support
Yeah.
community. So one of our social workers is the director of that, but she also sees patients for one-on-one counseling. And so we tell them, these are our services we offer, and they're used to, patient side effects, what patients are experiencing, how to help those side effects. So they can ask, are you having any side effects? Ways they combat those. If it's something related to their fatigue, then of course we can plug them into, exercise navigation or onc rehab visit. If they're already starting to see sexual side effects, we can plug them into our sexual health evaluation visit. If they are having trouble, again, with financial issues, one of the biggest things we see with patients is financial issues
Yeah.
and transportation issues.
Yeah.
And so we can plug them into our social workers that focus on distress management, financial navigation. So it really just depends, when we see that patient and kind of what's going on with them. But I do think, that all those services and kind of plug them in there.
Okay. So on the other end of the spectrum, Jason, what are you seeing people for 3 to 5 years out in your clinic for most of the
So
time?
yeah, so there's a few things. So we developed actually what we call our lifetime clinics. We have general lifetime clinic, adolescent young adult, as some know as AYA. We have a GYN lifetime clinic for GYN cancers. So typically we see these patients and we have their primary oncologist refer those patients to us, typically in that 3 to 5 year from active treatment period. And what we try to do, we like to be their oncology home. So, and that's going to vary depending on what organization, how big the organization is. We have our lifetime clinic set up, but some of these smaller organizations may not have a lifetime clinic. They're going to release the patient back to their primary care physician, which is totally fine. It's just that we decided we want to be their oncology home, so we did develop the lifetime clinics here. So they see our nurse practitioners once a year. Certainly, we go over how the last year's been, if they're having any issues. If they are, plug them back into our services that we've mentioned before. Say the patient, it's only been 3 months since their last lifetime clinic visit, and say it's a breast cancer survivor, they notice a lump in their breast. We can bring them in for an acute visit, perform, exam, order imaging. If everything's fine, it's fine. Keep me as back in surveillance. But if something, shows we need to fast track them back to their oncologist, we can, which is nice. So another way that we're kind of following our patients is we developed a survivorship registry. It's actually we set it up as a study actually through our IRB in the hospital. But we ask patients if they want to go on the survivorship cancer registry. And we've been doing this, I think, since I want to say 2014. So we send out, when we find out information for patients that might be interesting to them, or a study that a patient might be interested in, they qualify for, we can actually send that out to the patient. So say breast cancer patients who have had taxane therapies, which cause peripheral neuropathy. And there's a study that comes open studying peripheral neuropathy and ways to help with that. for the breast cancer population. We can pinpoint that population in our registry and send it out just to them, which is great.
That's really fascinating. I love the lifetime clinic idea. I think that while PCPs are incredibly valuable, they have to be comfortable with the fact that they know, or have a lot of comfort with the fact that they know that their patients are also seeing you,
Mm-hmm.
and that you have expertise in the area of oncology. And to a point you made earlier in the interview when you were talking about oncologists and 15-minute visits. If I'm seeing an oncologist for 15 minutes, frankly, that's what I do want them to focus on, is managing my cancer. And that is their wheelhouse. That's what they're very good at. And so having you available as you are, I think that's amazing to make sure that your patients are doing as well as they can from a holistic person standpoint, and then also having the best care available, the best disease management process, best cancer management process available through their oncologist. And having that whole person care helps people have better outcomes. We all know that.
Exactly. Yeah.
If you are doing well from a nutritional standpoint, a psychosocial standpoint, you have stress taken off of you from, or some of your stress at least taken off of you from a financial standpoint, you do better in your treatment, and you sleep better, and you just,
You
you
can focus on
tolerate
your
things.
treatment.
You can focus on your treatment.
Right.
And if you have transportation issues addressed, you can get to and from. And
Mm-hmm.
so that really lends itself to people having better outcomes. So I applaud you and your system for doing what you're doing. You probably have less admissions than a lot of other systems do, less emergency room visits, just by virtue of how the amount of support that your patient population has, and your
Thank you. Yeah.
and your survivor population has. I also find it interesting that you have come full circle from starting with the survivorship care visits, survivor plan visits,
Mm-hmm.
taking them back to the clinic now.
Yeah.
And yeah, and I remember those.
Oh,
And
yeah.
they're valuable. I mean, people then
They
can
are. I think
know.
they are still
Yeah.
very valuable.
And for our audience who may not be familiar, and Jason could probably speak to them better than I can, but they summarize your diagnosis, your progression, your
Mm-hmm.
treatment types, and what you were treated with when, so that you can take it to any, say you move from north to south, if you become a snowbird or whatever, you can take it to anyone and they can be fully made aware of what you've been treated with when. And that can be incredibly important with later in life development of any symptoms, say after radiation or after receiving something such as adriamycin, with some of the cardiac toxicity that develops, but also in terms of knowing when you should be evaluated for surveillance, when it moves, say, from once every 6 months to once every year to once every 5 years. I imagine it's pretty easy for something to fall off your calendar, off your radar. If
Yeah.
it's 5 years out,
Mm-hmm.
that helps you remember. So those are
Exactly. Yeah.
really important tools, but really important to have. Just, I think they're going to become more important as our survivors live longer. And so, keep those, take pictures of them, save them in your phone, if nothing
Exactly.
else.
Yeah.
Don't lose them. They're really important to have. Can you define integrative oncology for our audience?
Yeah. I know there's probably specific definitions out there, but for me, working in the Center for Integrative Oncology and Survivorship, again, it's just integrative oncology to me is incorporating modalities, recommendations, and ideas for, to treat the whole patient, is what I kind of feel. It's like, some patients come in and they're interested in acupuncture. That's considered an integrative therapy. Some are interested in massage therapy to help combat certain things about their cancer or their symptoms. So some are interested in herbs and supplements. And so we've had to, here, our dietitians and nurse practitioners in particular have had to really educate themselves on topics such as that. We've had to reach out, in the community and to find external partners for those patients, because we don't offer, for in particular, like acupuncture here, but we had to reach out and find, resources for patients. So, knowing that the patient is going to be looking for potentially alternative modalities to augment their survivorship or their treatment, and then knowing those and kind of building your toolkit. So to me, again, integrative oncology care is just treating the whole patient.
Right. And it's integrating it with their traditional care.
Correct.
And working as a team, basically, so that patient can do as well as they can.
And they feel cared for and heard.
Right.
So
being heard is so important.
Yeah. Because it's important to them.
Yeah.
If they're having an issue and they really think that a certain, modality or a certain, thing would help them, then certainly you want to talk to them about it, safety or pros and cons depending on what it is, like say for herbs, for example, and stuff. So, but then, just hearing the patient and helping them.
Speaking of that, what do you see looking back, say 5 years, is the evolution of the patient being heard?
I think in general, what I've seen over the past 5 years through my work here, and also with, I think we've talked before, I work with the Academy of Oncology and Nurse and Patient Navigators on the Survivorship Committee. And just over the past 5 years, I think there's been a huge movement in healthcare and in organizations to really create a survivorship programming patients. There's just been a larger move toward a shift toward that. Going to the conferences and talking with different peers and stuff, you've really seen it, which I think is excellent. Because beforehand, and even when we started to develop our program back in 2012, luckily we had a physician champion, which was our administrator, to really help move us forward and see the benefit to our patients. And that's hard when you work in either a large or small organization. So I've been very excited to see a bigger movement toward patient survivorship and building of programs and teaching of survivorship navigators. It's been great to see that happen in the past 5 years.
Oh, I'm very passionate about survivorship care, as you know.
Yeah.
And that's one of the reasons why this podcast is here, is first to hear the survivor voice and to hear about resources that people can reach out to, and to people feel more empowered to speak out.
Exactly.
And look for resources. What's your future vision for your clinic and survivorship care?
Gosh, that's a good question. How else we could get larger, and like what are we not meeting? Certainly one thing I think I would bring back that we had at one time was music therapy. It was one offering that we had for patients. At one time, we were supposed to have a larger cancer institute building that would be just this huge center that really incorporated integrative therapy and had massage therapy and acupuncture, music therapy, pet therapy on site. That would be awesome. To see that happen in the future. But just survivorship itself, there's been movement, as you know, legislation toward, the Survivorship Act that's going on and trying to address gaps in survivorship care, which I think it's great because we see that. And I know you'll still always have, and some of the smaller established organizations, because it all comes down to finances and stuff. How do you build programs with, and how do you staff them, and how do you educate them? Luckily for us too, we had a huge philanthropic support, which was great. So if people can, somehow utilize that or get the organization to do that just to help build programs, I just think it would be beneficial for patients.
I would love to see us shift or have medical necessity as a determinant, but also wellness necessity.
Yeah.
And really step back and look at that from a long-term planning standpoint, because I think if we did truly look at that as from a payer standpoint and a healthcare system standpoint, we would probably see our costs and care drop precipitously
Right.
after a couple years of investment, and our patients and ourselves be a lot happier
Yeah.
and do much better. But it would take a big gulp and a lot of investment, because that's going to take some risk up front to do that. But I would love to see that, because I think just from what I've seen of the small examples, people do so much better when they really understand investing in themselves.
Yeah.
When you look at the studies with yoga and mind-body connection, and to me, if a survivor does not, and you were talking about smaller cancer centers, if a survivor does not currently have access to an integrative oncology program or a survivorship program, how do you suggest that they might reach out to kind of either find that type of program or gather credible resources to themselves, find credible providers to see?
I would have them. I know not all have nurse navigators, but I would ask their oncologist or nurse navigator if they have one, to see if they know local practitioners in the area, if they're looking for certain integrative therapies that they have checked out. I would have them look for local organizations such as their local cancer alliance, to see what they have. I know ours, we plug a lot of our survivors into, and they help from everything from transportation to helping with certain financial needs, to nutrition needs, to counseling. Not everyone will have a local cancer society or alliance, but check into that. And then other online organizations such as Cancer Support Community that we mentioned before, and a lot of these online support programs will have links to others, which is great. So I know sometimes you have to be careful. People tend to go into a rabbit hole, when they're looking for different
Yeah.
things online. But things like cancer.org, Cancer Support Community, Live Strong, some of those are the more reputable organizations that'll have links to other sites.
So I would definitely look at your local cancer support organization, like you were saying. That shared experience is invaluable. And oftentimes they offer both virtual and in-person services and or meetings, and just dip your toe in the water at least once and
Yeah.
try, because it does make a huge difference in terms of how you perceive things and not feeling alone in your journey. Plus, you do hear about the other people there that have found resources can clue
Yeah,
you in to the people they have discovered.
exactly.
And those national organizations that you were talking about, Jason, are exceptional. Cancer.org is very accessible. Live Strong, like you were talking about, they are both great organizations. Is there anything that we haven't touched upon that is important to you to discuss?
I just go back to what we had discussed before about how we would kind of want to see things change. Because I was thinking about, as you were talking, to see the future of survivorship that would have planning for the patient. And I think there's legislation about, going on about this too. But, to have a plan for the patient that does include exercise and wellness and education through their cancer journey, because we know again from studies that people do better with certain interventions, with support, with navigation. That is what I wish really the trajectory would aim for
Yes,
in
I agree.
survivorship.
I agree. Um, I would also like a mapped out plan for expert survivorship care that is, if it's not immediately accessible in that person's healthcare plan, at least what type of specialist to refer that person to,
Yeah.
so that any provider can refer to that and get that person the help that they need and the resources they need, or at least point it in the right direction. I feel like so many times we have people that successfully complete treatment, but then are left, as we know,
Mm-hmm.
in the bag with a lot of symptoms. And that's where we're trying to get past, is get a good quality of life established and feeling really good and having wellness, having health.
Exactly. Establish that follow-up care.
Yes.
So
Yes,
many
that's
times the survivors are, they're used to seeing that provider routine basis. It's like their treatment ends and they feel abandoned.
mhm,
So trying to establish, whether it's just a nurse navigator doing it in your clinic or you have an actual survivorship program, establishing that follow-up care for the patient and,
right,
and having touch points along that timeline to follow up with those patients.
right. So having a, exactly. I agree 100%. So, Jason, thank you so much for your time today. I really appreciate it. I know your time is valuable, and thank you for everything you do and for the expertise of you and everybody that works in your clinic. You make big differences for the people that come see you.
Thank you. It's been a pleasure.
Thank you, Jason.